So something that's happened, I mean, dental implants are not new at this point. I mean, they've been around 50 years almost at this point, I think. But what has changed is kind of our understanding of the bone and the soft tissues and the relationship of those two implants over time. The oldest dental implants I think that people still have might only be 30 years old because the mouth at the end of the day is not a clean place. And, there's bacteria that can cause problems. And the best thing anybody ever had was their healthy, virgin, natural tooth. But when that tooth is lost, or maybe all the teeth are lost, the next best thing, and honestly, it's kind of a distant second, but when you're faced, with the tooth loss, it's kind of, you're lucky it's an option for you because it really is dramatically better than no teeth. But we have to place an implant. So an implant essentially replaces the root of a missing tooth. And the implant itself is essentially a titanium screw that goes into the bone, and it needs to remain undisturbed for 2 to 3 months typically for a process called osseointegration, which just means the bone cells are growing into the rough surface of the dental implant. Once that happens and the body is kind of integrated, that titanium screw with itself, then we can load it with a tooth. And so occasionally there are instances where we can place the implant and put a tooth on at the same time. It's not the majority of cases, but it can be done in certain cases, especially with a front tooth, or if we're doing like an all-on-X type of procedure where we're having multiple implants and having a temporary prosthesis put on there at one time.
So Dr. Bewley has a x-ray machine. It's a CBCT, and we take that at your consult visit, and he can plan out your whole implant surgery. I think it's down to the millimeter of the placement. Is that right, Dr. Bewley? Half millimeter. So it makes the procedure go flawless. I think you have a lot of times when it's a molar, you can replace a chewing tooth with the implant. Also, a lot of times if you're missing an opposing tooth, so if you're missing a tooth up top, your bottom tooth could drift up into that space, so it's always nice to get a replacement. But mostly for, just eating or cosmetic if you are missing your front tooth.
So there's different candidates for different things. When you have a missing tooth, or if you have a tooth that's broken that needs to come out, this dental implant can replace that tooth. Now, it's never going to be the exact same thing as your actual tooth, but it's the next best thing. Some options you can do are bridges, which we'll talk about in another section. But as far as implants go, it's basically like a little post that kind of hangs out in your bone. It integrates into your bone so that it's hopefully there with you for the rest of your life. There are some situations where you can get a little bit of infection around it, and you do have to have that replaced or taken out. But 99% of the time, that baby's going to be with you for the long haul. Once you get that post put into your mouth, you'll wait a few months for it to integrate into your bone, and then you can put your tooth on it. And that tooth will treat you just like any other tooth you've ever had in your mouth. You can floss with it, chew with it, whatever you want to do with it. It's going to be there, and it's going to take good care of you and help you chew.